Hi, and welcome to your pulmonary rehab education series on exercise progression. Today, our objectives are going to be to introduce the topic of exercise progression. We're going to discuss the benefits of doing more things. We'll talk about the Borg RPE and RPD scale. We're going to identify when it is important to increase and or decrease your exercise resistance. And we'll talk a little bit about modifying exercise. Now, to introduce the topic of exercise progression, well, we need to discuss, well, when we're exercising, how do I know if I should be doing more or if I should be doing less? Should we increase the workload? Do we need to increase the level? Do we need to increase the speed? And when we're talking about increasing our workload, it can be a combination of all of those things, depending on the type of equipment you're going to use. For example, if you see the picture with the orange arrow, that's one of our new steps. You can adjust the workload with the little knob to the bottom right. You can also increase your workload by adjusting your speed. If we're talking about resistance training, an increase in workload would be an increase in repetitions, an increase in sets, or how many times you're going to do those repetitions, or an increase in weight. Another way that we can increase or progress in our exercise is increasing the amount of total work time that we're doing. In the exercise field, we call that increasing our volume of work. So doing more over time. Maybe that's more within that exercise period for the day, more time for cardio, more time for weights, or more frequency, increase the amount of days per week of doing all of these things. So if you look on the bottom here, we have a continuum. And if you're looking at this continuum from left to right, the things that we do that require less or little effort are on the far left. So when you're asleep, it requires very little effort. You're just laying there, you're motionless most of the time, and you're just resting. Sedentary behaviors are something like what I'm doing right now. And if you're watching this on your computer or on a tablet or on your TV, you're sitting down likely. But as we start doing more things throughout the day, you'll see as we start moving from left to right on that little arrow, our continuum starts to change to something that requires a little bit more energy. So that's this idea of energy expenditure. What am I doing throughout the day? Well, certain tasks like brushing your teeth, okay, certain tasks like doing laundry, certain tasks like making the bed, going grocery shopping, or specifically for exercise, going out for a walk, riding a bicycle, using the new step in the gym. Things like that are different types of activities. Now, some of them may be more difficult than others, and some of us may perceive those activities to be more difficult than others. And that's why we like to use certain types of tools when in the gym to identify how hard am I working. Okay, so we're going to think about this continuum of how difficult it is. Well, certain activities might feel light, moderate, or vigorous at times, depending on how quickly you do them and how often you're doing them. So what's the benefit of doing more? Why is it important? Well, it's going to increase your exercise capacity. It's going to improve your physical conditioning. It can make you stronger. It's going to increase your strength. It's going to increase your endurance. Okay? These things are important because when we improve our physical capacity and our exercise capacity, that will translate directly over to those daily activities of living that we need to do to survive. So if you look over to the right here, I stated here we need to break the cycle. Okay? And if you think about some of the previous education that we've presented, and we've talked about this chronic pulmonary disease cycle where you have this decrease in ventilation, right? You can't breathe. It increases how short of breath you become. And ultimately, it reduces your ability to exercise. It ultimately then decreases how conditioned you are or how well you can perform doing other tasks throughout the day. That cycle will continue to be negative. Well, if we start doing some things to improve our physical conditioning, then we'll be able to increase our ventilation, meaning it's going to decrease our shortness of breath. It's going to increase our exercise capacity. It's going to increase our conditioning. Okay. And all of those things have a cycle, which will then in turn lead to less shortness of breath, more exercise capacity, more conditioning, more strength, better breathing. Then cycles back around again, less shortness of breath, more exercise capacity, more conditioning. Okay, so exercise and doing more is going to benefit you throughout the day, and you probably won't even notice it. And maybe if you do notice it, you'll be happy about that. Okay, the main thing about as you start to do more, you'll start to realize that you have a reduced perception of effort. Meaning, well, maybe 3 months ago or a month ago, doing the bed or doing my laundry was a very difficult task. Going back to this continuum, maybe it was a very vigorous task just for me to fold my laundry or vacuum the floor. As you continue to exercise and you start to challenge yourself to do a little bit more in a structured environment, that perception of how you feel when you're doing that activity of doing the laundry, if it starts to reduce, that means you've had an increase in your exercise or conditioning, an increase in your strength. And now that task doesn't feel as difficult. Now that should be very encouraging if you come across that, because if a task doesn't feel very difficult, the likelihood of me doing it more frequently is higher, as opposed to something that feels very, very vigorous or very hard to complete. I'm less likely to do a task like that because I know it's going to be challenging. I know it's going to be very difficult for me to do. So I want you to push yourself in a sense where the ultimate goal is to make things feel easier for yourself. So the benefits of doing a little bit more for your exercise as well is going to include decrease in that feeling of shortness of breath. Okay, so what that means is it's going to improve your oxygen exchange at the muscular level, okay, across the cellular level, which is what we really want, and that's what we know exercise does. So ultimately what that means is you become a more efficient individual. And when you're more efficient, that means you're not going to be as short of breath, okay, and you're going to be stronger. Okay, so say you go grocery shopping and you have a trunk full of groceries, and instead of having to take one bag in at a time and making multiple trips, maybe because you're a little bit more physically conditioned and a little bit stronger, instead of taking one bag at a time, you take 2 bags at a time. Okay, so some of the benefits like that will transition and transfer over immediately as soon as you start feeling a little bit stronger. So what we really want to do is break that cycle of being sedentary, because that cycle leads to being immobile, and we don't want that. We want you moving around as much as possible, right? Getting stronger and doing the things that you want to do and need to do so that you can live independently. So let's talk about this Borg scale. So this Borg scale is similar to this idea of energy expenditure. The more things we do, the harder they are. The less things we do, the easier they tend to be. Okay? So let's talk about these 2 different scales, and it's going to be important to use both of them congruently when we're talking about exercise. So let's start on the left here with the rating of perceived exertion, the RPE scale. Okay? That means how hard does this feel for you? How hard are you working right now? This scale is completely subjective. I can't tell you how it feels for you, okay? I would like you to be working out in a range somewhere in the green zone. If you're looking at the blue, green, and red picture there, the green zone is a number between 12 and 16. And some of the adjectives there say somewhat hard and hard. Now, again, because some of these activities that we do are different for every individual, maybe vacuuming might be a very vigorous activity for some, well, you might rate that a 17 or a 19 or an 18, and you're going to call it somewhere in the red zone where it's very hard. Okay. For somebody else, maybe vacuuming is light work, it's light activity, and they would rate it as, well, it's fairly light or very light, maybe 9, 10, or an 11. So you see that this can be very subjective for every individual. It's very individualized. But we use this as a way to gauge how the exercise is feeling for each individual. Okay? We can use it for daily activities. And a lot of times what we really want you to do is we want you to take into consideration the activity you're doing and how short of breath you are while you're doing this activity. So that brings me over to the right side, the right picture. The shortness of breath, modified Borg dyspnea scale. That's the blue scale on the far right. Now what you need to understand is you may or may not have persistent shortness of breath all the time. Okay? And it's important to know what level of shortness of breath is normal for you. Because some of you might have shortness of breath all the time. Maybe all the time you feel like you might have very slight shortness of breath, a number 1. Some of you may have zero shortness of breath at rest or nothing at all. But it's important for you to understand, well, if I were to look at these words here on the right-hand side for shortness of breath, am I short of breath all the time? Am I slightly short of breath? Am I very slightly short of breath all the time? Okay, that might be true, but you have to understand as you start to do more activities, and I'm sure you all know this, is once you start becoming a little bit more active with your exercise, with your daily activities, you become even more short of breath, and it's okay. Okay. The thing that we want to understand here is there's such a thing as too short of breath with any type of activity. And that's what you need to be cautious about. And I want to caution you that you should be very careful with how short of breath you become. You don't want to find yourself in that rabbit hole because it's really hard to get out of becoming short of breath once you've achieved that point of no return, because anxiety can start to set in and you can start to lose your rhythm of breathing. You'll start to forget about those techniques that we've taught you about, pursed lip breathing, controlled breathing, diaphragmatic breathing, which can help reduce your shortness of breath. All right. So again, because exercise can increase your shortness of breath, we need to use both of these charts together. Now, I like to tell individuals that you should pay attention to how short of breath you are prior to your exercise. That way you have a baseline. You have a way to notify yourself or kind of tell yourself what is normal for me right now, because I'm going to start doing something else that's going to make me even more short of breath. Then you're going to think about, well, once I start exercising, how hard does that feel on my body? How hard does that feel on my muscles? That's the chart to the left, the blue, the green, the red. Think about easy, just right, and very hard. Right? Just like the 3 little bears with the porridge. Porridge is too cold, porridge is too hot. We want the porridge somewhere right in the middle, somewhere in that green zone. I don't want it to be too hard and I don't want it to be too easy. So when you're exercising, you need to take into consideration, well, I don't want to work too hard because when I work really hard, it's going to make me really short of breath. Okay? And if I'm working too easy, I'm not going to get those good benefits that exercise gives me. So I need to find a sweet zone where I'm working hard enough where I'm going to get some benefits, but not too hard where I'm going to be very short of breath and find myself down that rabbit hole and be struggling to become less short of breath. So we're going to have some time to practice and understanding this while exercising in the gym. So I just want you to understand some of these scales and how we use them and how you can identify these things. You don't necessarily need the scale in front of you at all times, but you should have a good understanding of how to use something basic like this. So now let's talk about, well, when should I go up? I've been doing a specific exercise or I've been walking on my own for about 15 minutes at a time and I feel good, but I don't know, can I do more? Well, in order to understand whether or not you should or shouldn't increase your workloads, we need to talk about what happens when we are exercising and we've been exercising. It's important to understand that increasing your intensity is encouraged. We want you to do more, as we've stated. Our bodies are very adaptable. We are adaptable species. So adaptation to exercise is an indication to improve or to increase. An adaptation means your body has responded positively. Your body has become more efficient. So you want to think to yourself, do I feel a little bit stronger than I did maybe 2, 3, 4 weeks ago? Am I getting less tired as I'm doing this exercise? For example, if you're in the gym and you've been walking at 1.5 miles an hour for the past 2 weeks, your body gets used to that, right? It's less of an effort. I don't get as tired, or I don't get as short of breath. Or maybe I can last, instead of 10 minutes, I can last 15 minutes now. Well, just that change in 10 minutes to 15, you have now increased your volume or your load. So that's a positive thing. If you rate your exercise somewhere in that blue zone between 6 to 11, it's probably okay for you to give yourself a little bit more of a challenge. And I don't encourage you to go from 1.5 miles an hour to 2.5 miles an hour, but we like to do a gradual step-by-step improvement or progression. That way we don't overload your body and cause negative effects. Okay? So if you can answer yes to one of these statements here, are you stronger? Are you less tired? Do you have less shortness of breath? Do you think you can last longer? Do you feel like the exercise on the RPE scale is somewhere in the 6 to 11 range? Then you should probably try to challenge yourself and do a little bit more. Maybe a little bit more time, maybe an extra 5 minutes, or increase the workload a little bit. Try a little bit faster speed, try a little bit higher of a level. That will increase your workload, provide an additional stimulus for your body for more adaptation, for you to become stronger. The more you do, the more you are capable of doing, and the higher likelihood you are going to be able to continue to do those activities. All positive things. So what are some of the indications to have to decrease your workload? So a lot of people have this idea, and this dogma, this stigma has been out there for a very long time. No pain, no gain. That is the complete wrong way to approach exercise. When you exercise, it should not cause pain at all. If you have an underlying condition where you have arthritis, or you had surgery, or are in need of surgery in certain joints, that might be different, but we don't want to cause pain during exercise. So there is such a thing as doing too much. So we want to avoid things such as overexerting, okay? Because when you overexert or overdo things, it can potentially lead to increased fatigue, increased shortness of breath, excessive muscle soreness, excessive low energy feelings, altered perceptions of rating of perceived exertion and rating of perceived shortness of breath. Meaning doing something that shouldn't cause me to be very tired is now causing me to be very tired. Okay? Maybe it's a bad day. Maybe you didn't sleep so well. It is okay for that day to reduce your workload. It is okay for you to slow down for that day. Okay? But you need to understand, on the days that you feel very good, you should try and challenge yourself, especially if you feel that you're not working hard enough. So that's the benefit of using those two scales there. Am I working hard enough? That's the one on the left with the blue, the green, the red. And am I not short of breath? If those are yes, if I'm not working hard enough and I'm not short of breath, let's go up. If I feel like I'm getting stronger and I feel like I can do more, let's do more. If I'm not feeling so hot because I didn't sleep so well, or I'm a little bit sore, I'm a little bit tired, I'm a little extra short of breath today, maybe I had a bad meal and I gained some weight, and it could be some fluid retention, I probably want to maybe reduce my workload for that day. Okay? And then the next day we make these assessments and these judgment calls on a day-to-day basis. So if you are experiencing any of these things, increased fatigue, increased shortness of breath, excessive muscle soreness, low energy, or any altered perceptions of RPE and RPD, we probably would think about decreasing your workload for the day. Don't push yourself because you're liable to make yourself even more tired, even more short of breath, even more sore. Okay, so we want to think critically about those things. So how are we going to modify these exercises? Well, modifications can be positive, they can be negative, right? Or they can be progressions or they can be regressions. Let's think about it that way. A progression is let's do more, let's challenge ourselves. We can challenge ourselves with increasing the load, increasing the speed or the RPMs, adding an elevation to the treadmill, increasing your frequency, or introducing you to something we like to call interval training. And interval training is a strategic and scheduled manipulation of your workloads, increasing the times and the levels for a specific period of time, right? And then taking some time and backing them off, perhaps increasing your speed on the new step for 2 minutes. And then after that 2 minutes, you're going to slow down your speed and go at a slower pace for 2 minutes. And then after that 2 minutes, you go back up and you'll alternate back and forth between those two speeds. Okay, something like that is a strategy that we can use to increase the amount of work you're doing, which will give you additional benefits for your exercise. Some things that we do to modify when you're not feeling so good, well, we want to decrease your load, decrease your speed, right? Maybe even increase the time that you're taking in between exercises, adding some rest breaks in between or during some of your exercise equipments. Maybe change your equipment based on your needs. If you're having some hip pain, maybe I don't have you walk on the treadmill. Maybe I'll have you do a stepper or a bicycle. I'll modify movements for you. Make sure things are not causing you pain. And we can alter your range of motion so that we also limit pain or any type of discomfort you might be feeling or any type of restrictions you may have. So modifications of exercise are an extremely effective way to make sure we don't overexert ourselves or we keep you safe while you're in the gym. Okay, so those are all of the topics that I wanted to talk about. All right. The next thing we'll do now is we'll participate in our resistance band exercises, and we're going to do some stretching at the end. But before then, we'll go ahead and we'll answer any questions you have. I encourage you to think about how you can progress your specific exercises that you're doing here in our gym. That way we can answer them in a group setting during our education classes or one-on-one within the gym. So think about those questions and how you can increase your workloads while exercising here in pulmonary rehab. All right, thanks a lot. See you next time, guys. Bye-bye.